This is Damian McNamara with Elsevier Global Medical News, and I'm here at the Perspectives in Rheumatic Diseases meeting in Fort Lauderdale, Florida. And with me now is Dr. Norman Galis, who's a private practice rheumatologist also affiliated with the University of Miami. Welcome.
Thank you, Damian.
I appreciate it.
My pleasure to be here.
Now, one of the things you're talking about in this talk is the importance of early and aggressive intervention. Can you tell me why that's so important?
Well, I think it's become very well accepted and understood that early intervention makes a difference in terms of outcomes. So the earlier you treat someone, the less the damage is going to be. It's no different to a forest fire. If you can put that fire up in the beginning when the fire is just starting, you're not going to have the forest burn down. If you wait until the flames are sky high, the forest is going to burn down. So very simplistically, it makes a lot of sense to treat the patient as early as possible. There's been multiple studies that have shown that maybe 75% of the damage over the course of the disease is going to occur in the first 5 years. And if you take those 5 years and then you look at treating the patient within the first 12 months, you're going to dramatically affect the outcome by treating them early.
So how could you make a difference? How could you shorten that time to diagnosis with the patients?
Well, number one, educating both the patient population as well as the primary care population, because that's where the majority of early rheumatoid arthritis starts off with. So making people understand that if your joint suddenly becomes painful and swollen and you haven't injured it, something's wrong. You better go see someone rather than self-medicating yourself. Educating the primary care physician as to the features of an inflammatory arthritis.
And one of the emphases on your talk is on imaging and how imaging plays into that role of early recognition, and you talked about the different modalities and how MRI has some advantages over radiographs, such as digital storage and web-based analysis, that kind of thing. So what other advantages are there to MRI over radiographs?
Well, multiple. I mean, I think the first part of it is that radiographs only give you a story in retrospect after it's too late. So by the time you have an erosion appearing in radiographic imaging, you've basically had irreversible damage occurring in most cases. MRI is picking up findings, in particular synovitis and bone marrow edema, before the erosion. So it's a much earlier diagnostic tool in terms of providing you evidence than radiographs. Treatments today are very effective but very expensive. You put a patient on treatment and wait for the x-rays to change, you could be giving them 12, 15 months worth of treatment that is not working, that's very expensive, that's increasing their exposure to adverse events, and not have any way of measuring it.
So with an MRI, you see an early responder. You can identify those patients.
Within 6 weeks, you can see whether the patient is responding, and 6 months later, you can see if you've maintained the response, and if you haven't, you can switch them to another drug which will similarly be measured by virtue of what is happening on the MRI. So I think it's a very, very important tool in allowing us to measure whether our treatments are working or not.
Thank you. This has been Damian McNamara with Elsevier Global Medical News, speaking with Dr. Norman Galis. I appreciate your time.
As always, it's fun. Thank you.
Thank you.